All right, quick tips again on breastfeeding. Lots of questions from moms about when's my baby full? Do I need to switch sides? These are common questions I get. So I'm just gonna give you what I've got. All right, so when we put a baby to breast, the baby usually goes at breast pretty fast with rhythmic sucks after the first couple weeks. Remember, the first couple weeks are super confusing, but after the first couple weeks, baby's gonna go to breast, it's gonna take breast, and we're always gonna wonder when the baby's full or when it's done. Here's a piece of advice. When you go to take the baby off the breast because you think the baby's done, and the baby senses that you're pulling away, this is what I want you to do. I want you to judge what happens if you leave the baby there. If you leave the baby there and the baby simply just kind of does some light suckling, not real active suckling and eating, but just some light suckling, baby's probably full. It's just hanging out with you because it loves where it's at. It's okay to do that, but what I want you to know is, hey, the baby's done eating. I don't need to sit here for 30 minutes. Okay, if the baby's still hungry, what's it gonna do? It's gonna go back to that rhythmic suck, swallow, breathe pattern. Suck, swallow, breathe. Suck, swallow, breathe. The baby wasn't done eating. Simple. Okay. All right, so when to switch sides. Here's what I practice. I try to teach this in the most common sense form possible so we don't overcomplicate it and use words like fore milk, hind milk. There is such a thing as fore milk, hind milk. I'm not gonna touch on it. Here's what I want you to know. Your baby needs the component of every breast at the feed. So if we do 5 minutes and 5 minutes, wrong. If we do 7 minutes and 7 minutes, wrong. This is what we're gonna do. One complete feed all at once from one side. So I call this appetizer and main course. And then we offer dessert. So appetizer and main course. We're gonna give that until the baby's full by using those signs that I talked about earlier, whether the baby is actively pulling and suckling or whether the baby is just quiver suckling. If the baby's just quiver suckling, the baby's probably done. We need to unlatch and burp, okay? So we offered appetizer and main course. Now we're gonna offer the dessert side. Listen, the baby doesn't have to take that side. We don't have to feed it both sides. We're just simply gonna offer it. And why? Because it's just a tip off, right? We're just topping off whatever the baby may have burped out or whatever. The baby doesn't have to take it. So how do you know what to do for the next feed? Well, you're gonna start with the side that you offered last, and you always offer the dessert side. So we're gonna get a nice full feeding now from this side. We're gonna do the same thing. We notice baby's done suckling. We're gonna burp the baby. We're gonna offer dessert side over here. Okay, baby takes for a minute, 2 minutes, nothing at all. This is the side we offered last. Whether we got it out of our bra or not, this is the side we offered last. So the next feed happens, we start with the side we offered last. Try to keep that in mind. We don't do equal.